Understanding secondary condition claims for VA disability compensation purposes. A VA secondary condition claim is a type of disability claim where a veteran seeks compensation for a condition that develops as a result of an already service-connected disability. The secondary condition does not need to have been directly caused by military service. Instead, it must be medically linked to the primary service-connected condition. How secondary conditions work. You must already have a primary service-connected disability. Primary service-connected condition, a disability the VA has already recognized as service-connected. Secondary condition, a new medical condition caused or aggravated by the primary condition. For example, a veteran with service-connected diabetes develops peripheral neuropathy as a result of their diabetes. In this case, peripheral neuropathy would be considered a secondary condition. Why am I having trouble swallowing? Sarah asked herself. I feel like there is a lump in my throat and my chest burns. Sarah went to her doctor, thinking she was having symptoms of a heart attack. You are experiencing heartburn, likely caused by the pain medication I prescribed you for your ankle, her doctor told her. I'll need to prescribe you something to control that, or else you will risk erosion and damage to your esophagus. Some common secondary conditions are PTSD leading to sleep apnea. PTSD can contribute to sleep disturbances and increase the risk of sleep apnea. Knee injury causing back pain. A knee injury alters gait or posture, leading to secondary back pain. Diabetes, leading to peripheral neuropathy or kidney disease. GERD, gastroesophageal reflux disease, causing sleep apnea. GERD aggravates respiratory conditions, which can cause or worsen sleep apnea. Medication side effects, if medication for a service-connected condition causes another health issue. For example, high blood pressure or weight gain. That condition can be claimed as secondary. Tinnitus leading to insomnia. Tinnitus can interfere with sleep and lead to insomnia. The noise may be louder in a quiet bedroom environment, causing restlessness and difficulty coping with daily demands. More common secondary conditions. Radiculopathy. Secondary to back injuries or spinal conditions, causing nerve pain, weakness, or numbness in extremities. Depression and anxiety. Secondary to chronic pain, Parkinson's disease, or terminal illnesses like cancer. Hypertension, high blood pressure. Often secondary to PTSD or conditions causing long-term stress or physical limitations. Erectile dysfunction, ED. Secondary to treatments for prostate cancer, diabetes, or medications for PTSD. Gastroesophageal reflux disease, GERD. Often secondary to medications for PTSD, chronic pain, or sleep apnea. Migraines. Secondary to traumatic brain injury, TBI, PTSD, tinnitus, or neck injuries. Chronic fatigue syndrome. Can stem from conditions like fibromyalgia or PTSD. Arthritis or joint pain. Secondary to altered gait from a service-connected knee, hip, or back injury. Kidney disease or renal failure. Often linked to diabetes mellitus or prolonged use of medications like NSAIDs for pain management. Heart disease. Secondary to hypertension, diabetes mellitus, or certain toxins. Tinnitus or hearing loss. Secondary to head injuries or exposure to loud environments, often linked to military service. Anemia or stomach ulcers. Secondary to long-term use of medications, particularly for pain. Anxiety secondary to tinnitus, chronic pain, fatigue, migraines. Asthma secondary to allergies, nasal polyps, vocal cord dysfunction, COPD, asbestos, toxic exposure. Depression secondary to chronic pain, fatigue, migraines, tinnitus. Erectile dysfunction secondary to PTSD, hypertension medications, prostate cancer, heart disease, Parkinson's disease, spinal cord injuries. Fibromyalgia secondary to IBS, migraines, anxiety, and depression. frequent urination and incontinence secondary to certain medications, or prostate cancer. Hypertension secondary to sleep apnea, kidney disease, diabetes, gout, toxic exposure. IBS secondary to medications, or toxic exposure. Migraine secondary to cervical strain, insomnia, TBI, tinnitus, GERD, heart disease, asthma. PES planus secondary to overcompensation of back, hip, and knee condition. Plantar fasciitis secondary to PES planus, and overcompensation from knees, hips, and back. Radiculopathy, lower extremity, secondary to lumbar back condition. Radiculopathy, upper extremity, secondary to cervical back, neck, or shoulder condition. Sleep apnea secondary to sinusitis, rhinitis, asthma, PTSD, deviated septum. Vertigo secondary to tinnitus, TBI, migraines, medication side effects. Now that you have an idea of what a secondary claim is, and what conditions are secondary, let's look at how to successfully file this type of claim. Keep in mind, you will need a medical diagnosis. If VA Healthcare has diagnosed and treated you for the condition, you will not need to submit those records. You will, however, need to show VA Healthcare in Section A on page 11 of VA Form 21-526EZ. If treatment is from a private doctor, you should download those records and submit them along with the claim. You can ask VA to request them on VA Forms 21-4142 and 4142A. VA will make one attempt to request them. If your doctor does not respond, it is up to you. So, why not just go ahead and get them so you can submit them with the claim? You will file the secondary conditions on VA Form 21-526EZ. Once again, complete the entire form fully. Do not forget to sign and date the form in Section 933A on page 13. On page 11, you will list the conditions, what they are secondary to, and when they began. Remember, it is also best to reiterate on the condition you are filing, how it related to your service-connected condition, and how it affects your quality of life on VA Form 21-4138. Use VA Form 21-0781 if you are claiming a mental health condition such as anxiety or depression. Find a reliable medical case study online if you are filing a condition for an unusual diagnosis. For instance, degenerative arthritis can cause glaucoma in some individuals. You can submit the claim directly in va.gov through an online submission tool such as Access VA. This is also known as VA Quick Submit. Directly to your local VA regional office, or through an accredited VSO in your area. The last option would be to mail to the VA Claims Intake Center. However, I do not highly recommend that option. VA will process this claim just as they would any other claim. You will be required to attend a compensation exam. That's it. Now you should have the knowledge needed to file a secondary claim.